and thank you so much for joining. My name is Dr. Keita Williams, and I'm a board-certified neurologist. I put this video together especially for you, the patients, because oftentimes what I noticed in practice is that many patients don't advocate for themselves. And so I put this video together today to let you know that it's okay as a patient to ask your doctor questions. As a matter of fact, it is your right to ask us questions. And the reason I say this is because you only have one body. That's it. And if something happens to your body, you're the one who has to live with that. Now, your physician is there to ask questions and to try and find out what exactly is the issue that you've come to the doctor with that day. Now, what unfortunately oftentimes happens is that the doctor will see the patient, the doctor will make an assessment, the doctor will tell the patient exactly what he or she should take or do from that point on. And many times the patient does not ask questions of their physician. And I've asked patients on many occasions, and I'll say, why didn't you ask your doctor that? Because sometimes what they'll do is that they'll come and they'll say, well, why did my primary care doctor put me on this medicine? And why did he say for me to take it this many times a day? And I'm thinking, well, what did he say when you asked him that question? Well, I didn't ask him. So then my question is, why not? And I get a number of reasons as to why not. They'll say, well, I didn't want to be disrespectful. Well, I know he's busy. He didn't have a lot of time. They mention all of those kinds of things. But what I normally tell patients, and what I'm telling you today, is that you are the most important thing in that room at that time. You have the right to ask questions, and you very well should. But what happens if you don't? What happens if the doctor makes a decision and runs with it? It could actually result in you getting a bad diagnosis, the wrong diagnosis, and any number of other things. Okay. So what I want to say to you today, and the whole purpose of this video, is to teach you how to advocate for yourself. Now, when I was in medical school and when your doctor was in medical school, there were certain questions that they gave us to teach, well, basically in order to find out what it is that the patient presented with. And those questions, we're supposed to utilize those to basically pull information out of you. And when we use those questions, we're able to hopefully pinpoint either what the diagnosis is or what study or test we need to do in order to find the diagnosis. So what I want to give you today are those questions. Yes, I want to arm you with those questions. And why I say that is because if you know the questions your doctor should be asking you in order to find out the diagnosis, then you can already when you get to the doctor's office, you can already be armed with those questions. And if you're armed with those questions, you're giving him all the answers to the questions that he or she should be asking, then what you're going to do is put yourself in a better position to receive the accurate diagnosis or the accurate testing. Now, first, what I want to do is I want to give you the questions. And these are the answers to the questions. You're supposed to come up with the answers. And my suggestion is that you have these with you in your back pocket, in your pocketbook. When you walk through the front door, you're ready. Then the less likely, there's a lower chance or lower likelihood that you're going to go out of there saying, I don't know if I even got a chance to tell my doctor why I was here. So let's get into that. Now, first of all, these questions are going to be utilized by your doctor if you're presenting with a worsening symptom or a new complaint. Now, if it's just a random follow-up visit or well check, then maybe you're not going to need this. But I'm saying specific things that you're concerned about. So let's get into that. First of all, I want you to understand that the best way for you to remember this is remember OPQRST. OPQRST, just like the alphabet, okay? And the last one is AS. But if you can remember OPQRST, AS, then you'll remember these 7 questions. The first question is onset. When did your symptom start? So you would say, oh, maybe, my symptom, I have this pain in my neck or my shoulder or back, whatever, and it started 5 months ago, okay? The next one is P, okay? And that's provocation or palliation. Basically, what makes it worse? What makes it better? Oh, I have the pain that's in my back. It's worse when I stand up. It's better if I sit down, or, vice versa. And so basically you're telling the doctor what makes it better, what makes it worse. The next thing is Q, quality. What is the quality of the pain? Is it a burning pain, a sharp pain, a stabbing pain, etc.? The next one is R, for radiation. Does that pain radiate? Oh yeah, doc, it radiates from my back all the way down my leg. Does it radiate? Does it move? Okay. The next one is S, setting. In what setting does this occur? Does it occur when you're eating? Does it occur when you're sitting, when you're exerting yourself, etc.? The next one is T, timing. How often does it occur? Okay, because you told the doctor it started 5 months ago, but that's not all he needs to know. He needs to know, does it happen twice a day, once a week, okay, twice a month? And then not only that, but how long does it last? Well, the pain, it happens about twice a day, and it lasts for about a second. It just shoots down my leg and it lasts for about a second, or it lasts for 2 hours, or it lasts for 3 minutes. Give some type of timing. Okay, and the last one is AS, associated symptoms. Basically, are there any other symptoms associated with your pain? For instance, is there nausea or vomiting or lightheadedness or headache, etc.? So if you put these things together and you have this all written down in your notebook before you go to the doctor, that's going to put you in a better situation to basically advocate for yourself. Okay? Now, we're going to do a scenario, and where I have brought somebody here on the video with me who is going to run through a couple of scenarios. The first scenario is going to be the typical case of what happens. A patient just essentially trusts the doctor and trusts whatever the physician says, and they go from there. And then we're going to basically do another scenario where that doesn't actually happen. So at this time, I want to introduce our special guest for the day. And this is Miss Sherry Young. Miss Sherry Young, thank you so very much for joining me.
My pleasure. My pleasure.
Okay, so Miss Sherry Young is amazing, and then she's going to be our patient. So in a moment, you're going to see our name switch from Keita and Sherry to patient and to doctor and patient. And we're going to go on into this scenario that I hope you'll find very, very helpful. All right, so are you ready?
Ready.
Amazing. Okay, so we're going to get started now, and I'm just going to introduce myself. So hi, Mrs. Smith, how are you today?
I'm fine. I'm actually not so bad.
Excellent. Did you have any problems finding my clinic at all?
Well, I didn't. I've been to this building before because I used to take my mother when she was having her treatments.
Oh, okay. Now, who did your mother see?
She was a patient of Dr. Haynes.
You know what? I love Dr. Haynes. He is one of the nicest guys. I mean, your mother was in good hands with him, right?
Yes,
awesome,
yes, he did good.
So, Miss Smith, I know we just had a holiday, and I just want to ask you, how was that? Holiday, was it good with your family, and did y'all have a good time and all of that?
Well, it was interesting, with everything going on. A little different, but it was pleasant.
Yes. So, Miss Smith, what brings you here today?
So my neck has been bothering me lately.
Now, point to exactly where your neck is bothering you.
It's been hurting right back here.
Okay. And tell me this, does it hurt all the time or just every now and again?
Actually, it's just on occasion. I can't get comfortable at night when I sleep because of it.
Well, if that's the case, then what I want to say, first of all, is that's not good. And I hate to see that you're suffering like that. I mean, that really disturbs me that you wouldn't be able to sleep, because guess what? We have to sleep, right?
We really do, yeah.
You need sleep. You have to have it. Well, what I want to do for you, Miss Smith, is I'm going to send you to physical therapy. Okay. We've got an awesome physical therapy department here. I mean, Miss Smith, it is amazing. I'm telling you, some of the nicest people you ever want to meet. You're going to meet them when you get over there to physical therapy. They are just spectacular. And I just want to send you there and, let them work on your neck. And, after they get done with that, and then you and I will come back, we'll circle back through and we'll follow up, let's say we'll come back together in about a month. Okay. Cause that's
Okay.
enough time for them to kind of see what needs to happen and everything. And,
Okay.
well, yeah, so what I'm going to do is I'm going to set all that up for you. Okay. And
Mm-hmm.
the nurse is going to come and she's going to get everything set up, and we're going to take excellent care of you. Okay. It's so nice to meet you.
My pleasure. You are such a nice doctor.
It just warms my heart to hear you say that. I'm just doing my job. That's all. That's all I'm doing, Miss Smith. All right. Well, thank you so much. Okay. Well, we'll see you later. All right.
All right.
All right. Thank you. Okay. So that was scenario number 1. And what I want to say, just to the viewing audience here, first of all, what did you notice? Did you notice anything? Well, I noticed something. First of all, the doctor did not ask enough questions. The doctor did not ask enough questions regarding the patient's pain. Okay. The next thing I noticed is that even though Miss Smith told the doctor, "Oh, you're so nice," well, guess what? Nice doctor does not always equate to good medical care. Okay. It's not one and the same. You would hope your doctors would be nice. Absolutely. But what you want more than anything else is that your doctor is going to give you adequate care. The last thing I noticed is that there was a lot of time spent on pleasantries. And what I mean by that is, oh, how's the, Thanksgiving or the holiday, and how's this, and where's your mom go? And a lot of the patient responding to those pleasantries and all of that as well. I need you to understand one thing, and that is you may have 15, maybe 20, maybe 30 minutes tops to tell that doctor what is bothering you, what got you out of bed to come all the way to the doctor's office and search for a parking place, all of that. That period of time that you're there, you only get 15 minutes to say what you need to say for your health and your benefit. Skip the pleasantries. And I have to tell you, the doctor is lovely, the doctor is nice, but they're not there to be your best friend. They're there to help you find out what is going on with your body. So cut straight to the chase. If the doctor wants to do all this pleasantry stuff, you can do it at the end. But remember, you have 15 minutes to state why you're there. So let's go on to scenario number 2. All right. Well, hello, Mrs. Smith. How are you today?
Doing pretty good. Doing okay.
Good. Miss Smith, did you have any trouble at all finding the office?
I didn't because I've been here before bringing my mother.
Oh, okay. All right. Well, wonderful. I know that your mother, she saw another one of the doctors here in the area. Is that right?
She did.
Okay. Well, let me ask you, how was your holiday? Did you have a great holiday?
The holiday was pleasant. They are always good when you're managing to be with family one way or the other.
Okay. So tell me, what brings you here today?
Well, I'm coming in because I've been having pain in my neck, and I would have had a better holiday if the pain wasn't there.
Oh, okay. Well, since you brought up the pain, can you tell me about the pain? Can we talk about it?
Actually, we can. I brought some notes to share. I always got something written down. So I got a couple of notes. Do you mind if I share from them?
Oh, no, not at all. Go ahead. You came
Okay.
prepared.
All right. So then let me just say, I'm having this neck pain, and it started about 2 months ago. And it's located primarily right here, but sometimes I feel it on the other side as well. When I'm turning my head, it seems to get worse. And it remains, if I remain still, then it's not quite as bad. It seems better. Sometimes it goes away when I put my hands up. If I put my hands on top of my head, it's a sharp shooting pain, almost like an electrical current. It moves from my neck down my right arm, and sometimes my arm even goes numb. It can occur, anytime, anywhere. It happens several times a day. It's a shooting pain in that arm, and usually for a few seconds, but afterwards I always have a dull aching pain in my neck. I noticed that lately I've been having headaches in the back of my head that I think might be starting right at my neck. That seems to
Okay.
cover it.
Is there okay, so is that thank you. That's a lot of information. You know what, Miss Smith? I don't know how you knew to do this, but you gave me every answer. I don't have any more questions to ask you because you kind of gave me everything I was going to ask you. So first of all, thank you so much for that information. You made my job a whole lot easier because you basically told me everything. But I just want to say that just from listening to you, it seems like with you explained that you have pain that shoots down, goes from your neck and shoots down the right side of your body,
Right.
right arm. It sounds like you may have something called cervical radiculopathy.
Mm,
Okay. And basically that's just nerve damage, in that could be in the spine. And so when I hear this, what we're going to do is we're going to, we can send you for I can send you to physical therapy. That's what I'll do. I'll just send you to physical therapy.
okay, so two things. I'm going to ask you to spell that for me because I'm going to go home and look it up as well. I always want to do my own research. So would you spell that? You said cervical.
Oh, cervical, absolutely. Cervical radiculopathy. That's cervical. That's CER. Okay.
CER.
Huh?
Uh-huh.
VICAL.
Okay. Uh-huh.
Now, radiculopathy is a very long word. Okay. So that's
Okay. Mm-hmm.
RADICULOPATHY. So
Okay.
how do you feel about that? I'll just send you straight on off to physical therapy and everything's going to be just fine. Are you okay with that?
Well, let me ask. I heard people talking about things like what you just described. Is there actually a treatment for it?
Actually, now that you're asking me that, here, let me do this. Let me first send you for an x-ray of your neck.
Okay.
Okay. Let
Okay.
me send you for an x-ray of your cervical spine. And the reason why we want to do this is because we want to make sure that there's nothing there, misalignment in the bones of your neck, okay, or if there's not any disc that could be causing an issue there, okay? Those are discs right in between the bones there. Another thing that I would like to do, now that you're kind of asking me more questions about this, is I want to give you a medicine that's going to help kind of cool down the inflammation that's there. So that medicine is what's called an NSAID, or non-steroidal anti-inflammatory drug. And that's similar to like your ibuprofen, but I'm going to give you one called ketorolac. And that's just a little bit stronger than what you would normally get in your pharmacy, that type of NSAID. So we're going to do those two things. And what I want to do is to see you back after you've been on that for at least, let's give that, for about a month's time, understanding that, ketorolac, you can't take that more than 5 consecutive days in a row. Okay. That's
Mm,
just for
okay.
your kidney. Yes.
Okay.
So let's do that. And then let's follow up in about a month's time from now. And then we're going to see if that helps to cool things down.
Okay, so I'm gonna look up that medication as well to see how it interacts with the other things I'm already taking. And let me ask you also about a CT or an MRI. I've heard people talk about when they have stuff like what I've got, those two. Should I be doing that?
Very good question. So let me just tell you the reason, my thought process for doing an x-ray first, as opposed to sending you for a CT or an MRI. Well, first and foremost, if we're able to kind of calm things down just by giving you the NSAID, okay, then we're good. So we don't have to go further and look for more. But if you come back
Okay.
here after you've kind of been, and if you need to come back sooner than the month, I'm just trying to give it some time to work. But if you come back here and we see one another and you're still having the same pain,
Hmm.
then what we could do is do more testing. So we would
Okay.
send you for an MRI of your spine to look at it closer. Now, let me say this. Your insurance company essentially is going to force me basically to get this x-ray first.
Okay.
before giving you the MRI, simply because, they kind of want to make sure that we've done the smaller tests first before we go on to larger tests. Let's see what happens and what you find on an X-ray before we go on to more extensive exam and more expensive, imaging studies. So though that is the reason why. So let's kind of see what happens with this treatment plan first, and then if we need to go on further, then we can. Does that make sense?
It does. It does. And I appreciate you taking the time to explain it to me.
That's not a problem at all. And thank you so much for coming to the appointment already so prepared, because that kind of that really helps, and that helps to kind of direct things. And so I thank you so very much. Is there anything else that I can help you with?
I think that's pretty good. We'll see how this works, and I'll look forward to seeing you again.
Likewise. And so what we'll do is we'll have you sit tight. My nurse will be here to ask you about your pharmacy and to get that information from you, that we can get the script e-prescribed right on over there. Okay.
Okay, good deal.
All right. Thank you so much, Ms. Smith. You take care.
Thanks.
Okay. All right. So here we are. We've done 2 scenarios. My first question is going to be for you as the patient. Tell me, how did you feel? Scenario 1 versus scenario 2.
So I always go in the doctor's office knowing that I've got a time, but the first one felt particularly rushed. Saw the doctor looking at the watch, which is, time is money, but I didn't feel empowered at all in the first visit. The second visit, however, I felt empowered, came in with information, with a list of questions. I knew what was going on. I knew what I felt. So certainly I felt much more empowered, and because the doctor was willing to engage in conversation, felt more like a partnership.
Got it. Got it. That says a lot. And I wanted you to say that and basically mention that for the listening audience. I want to say this, and that is just, remember, everybody who's listening, use those 7 questions. Have those answers written down to the OPQRST. Have that written down. Have that in your back pocket. That's invaluable. The difference is between night and day. And while we have a lot of issues with healthcare that we cannot control, there are a lot of things that, are beyond the control of the patient. Some things are within your control. And so I just want to encourage you, as you're listening today, take advantage of what you can. Okay. Advocate for yourself. Interrogate your doctor. Okay. It's okay to ask questions. You have only one body. So I just want to say, we're going to close out, but Ms. Young, do you have anything you want to tell directly to these people who are listening to you? These are patients, and they're resonating with you because you are the patient. They identify with you. Speak to them. Look right into the camera and speak to them.
I certainly do have something to share. I think the biggest lesson or reminder from the scenario that we just went through is that our health maintenance is like a marriage partnership. In order for it to be successful, both partners have to participate. When I am in with my doctor, he or she has a responsibility, but so do I. If we don't both do our part, it will not work. I cannot assume that the communication is clear unless I make it clear. They have the academic knowledge, the book learning, if you will, and the medical expertise. But I know my body. So unless I'm clear about what's going on in my body, they can't properly apply their medical knowledge. Since there are, no matter what illness, there are no routine cancers, no routine diabetic cases, no routine hypertension, although each of those illnesses have similarities, what I need is different. I have to take responsibility and ask questions. What's that quote? In all of that getting, get understanding. Sometimes we act as though we are in the presence of greatness because we are in the doctor's office and they are so smart. They are. And I respect that. but I'm paying the doctor either with my own hard-earned money or with my paid into insurance. Either way, I'm the recipient of a service and they are the service provider. The doctor is getting paid to work for us. So I go in armed with the knowledge that it's a partnership. My quality of life is contingent on what takes place during those visits. Your quality of life takes place based on those visits. So I guess the real question on the table, Dr. Williams, is how well do we really want to live?
Thank you so much, Ms. Young. And I appreciate your wonderful comments and words of wisdom for the patients. I want to say thank you to everybody who is watching this video. And I want to encourage you to share this with your friends, with your family, with anybody you think would need to hear about how to advocate for themselves while they're in the doctor's office. If you enjoyed this video, don't forget to like the video, and don't forget to subscribe to my channel. Click subscribe below and be on the lookout for the next video very soon on when to ask for a second opinion, okay? Because sometimes you just might have to. Now, understand that if you enjoyed this video, just leave a comment below, basically stating that you want more videos like this. If there are any particular topics that you want me to discuss, also mention that as well. All right. God bless you all. Thank you so much for watching. Take care.